The public charge rule has no effect on the vast majority of immigrants currently living in New York City. That was the consensus of this media roundtable hosted by the Mayor's Office of Immigrant Affairs, meant to clear up misconceptions and confusion on the first day the U.S. Department of Homeland Security announced the program would go into effect. It's a move being watched closely as immigrant advocates are seeing thousands disenroll from critical services such as food and health care programs. Here's a plea from the Mayor's Office of Immigrant Affairs, Commissioner Bitta Mustafi.
Please don't disenroll needlessly. This likely does not impact you if you're currently in receipt of benefits, and if you are seeking to become a green card, we want you to get connected to good legal service providers.
The rule announced by the Department of Homeland Security looks to decrease the number of immigrants seeking green cards should they need government benefits. The fear, though, with leaders here is that New York City's current immigration population will disenroll from critical services such as SNAP, as seen in this data that shows that in zip codes with the highest number of non-citizens, thousands disenrolled from the Special Supplemental Nutrition Program known as SNAP and Women, Infants, and Children's Food Program known as WIC. Since 2017, it amounts to an 18.7% drop in zip codes with the highest number of immigrants and a 5.7% drop in zip codes with the lowest.
The public charge rule only applies to people who are trying to get their green cards through family members, a little bit through their employers sometimes. Mostly it's family-based immigration that's implicated, but people who are trying to get their green cards through other methods, through humanitarian categories like having refugee or asylee status or having a U visa for a certain period of time, things like that, public charge does not apply at all.
The concern extends from food to health care. Chris Keeley from New York City Health and Hospitals Corporation says their doors are open to all New Yorkers, regardless of their immigration status.
We serve over 1 million New Yorkers every year, including hundreds of thousands of New Yorkers that were born outside the United States. And what's important to us, what's most important to us, is that those New Yorkers continue to seek care with health and hospitals without fear. Know that health and hospitals is a safe space.
Those with further questions are being invited to reach out.
We've made resources available for people to get their questions answered before they disenroll from any benefits, food, health, housing, or otherwise. They can call our Action NYC Legal Services hotline at 1-800-354-0365.
The biggest takeaway here is that if you're on Medicaid receiving food stamps or cash benefits, the public charge does not impact you. It is in litigation right now and will be going before the Second Circuit. We will keep you posted with the latest. For BronxNet, this is Arlene Makoko.